Thank you for joining us to watch the next in a series of the videos that we are offering to men receiving hormone treatment for prostate cancer. I'm Louise Field. I'm involved with Adore Your Pelvic Floor, and I'm joined yet again with our lovely Debbie Dillion, who is a women's and men's pelvic health physio with a special interest in men's health. And she has been working within the NHS and privately for many years. How many years, Debbie?
20 years in the NHS and probably 10 years privately.
Oh, wow. And Debbie, you are the ideal person to ask about pelvic floors and men's health with regards to, again, how hormone treatment can affect their pelvic floors and how to do their exercises, because we know that's so important. So over to you, my darling.
Hi, Louise, and so lovely to chat to you again. You're such a star for doing this for the men. They so need it, so thank you. So yes, we're both passionate about talking about pelvic floor, aren't we? So, yeah, I mean, as Louise said, I have a huge interest in treating men. Unfortunately, male's pelvic floor hasn't been as much researched compared to female. Yes, there's more and more research out there. And you have Joanne Milios has probably been one of the kind of researchers over in Western Australia who's amazing. And so what I'm going to focus is on kind of more how Jo teaches things nowadays. But most of her research was to do with the men who've had their prostate removed or the prehab before having the surgery. But this clinically, I find works really well with the men. Yeah. So we all have, we all have a lovely rib cage. You have your abdominals, you have the pelvic floor underneath, and then you have all the muscles, your back muscles, so many different muscles. So in any pelvic floor, I say to everybody, I mean, if you look at the pelvis, think of what's inserting into it. I mean, there's so much coming down here. So just think of how important that pelvic floor is. And, men, it's not even mentioned. I mean, loads of men, when they have, get the diagnosis of prostate cancer or get to have problems with the waterworks, the bowels, or erectile dysfunction, they end up kind of going, oh, do I have a pelvic floor? And so it is so, so important to get this spoken about more and kind of start it to work. So with any muscle, physios love kind of the full range of movement of muscles, okay? And so that's what's really important with the pelvic floor, because we want it to get strong, but we don't want it to be overused either, okay? And so if I go into why it's so important to get the pelvic floor working, so we have the bladder, underneath you have the prostate, or the men have the bladder, the prostate, and then underneath you have the pelvic floor. So there has been some research done, and we don't know why some men use their pelvic floor automatically more and other men don't. So obviously, I'm presuming that most of these men coming to watch this at the moment haven't had a prostatectomy, so haven't had their prostate removed. But obviously, if they've had any hormone therapy or any radiotherapy, then that's going to have issues around that prostate. So they're going to need that pelvic floor to work more, okay? So that's kind of first where we're coming from. So as I said, you have so many muscles coming into the pelvic floor. So thanks, Louise, who told me about this. It's the best thing ever. So you have your diaphragm on top, okay? They're the abdominals. Behind, we've all the back muscles. And underneath you have the pelvic floor. So what I say to people is, if you put your hand on your rib cage, you can either do this in lying or sitting, just to make sure you're comfortable. So nice and easy, I want you to take a breath in. So as you take a normal breath in, so we don't want a big, okay, I don't want to see the air going up into the shoulders. Okay, so nice and easy, take a breath in, so that breath is going down into that rib cage and that belly is inflating, okay? And then the pelvic floor drops, which you won't even notice, it relaxes. And then on the out breath, everything contracts again. So it's a piston effect. So what's really important is you're just doing a nice normal breath and breathing in. And so it's going down to the end of that rib cage so that your belly is inflating almost automatically. Your pelvic floor drops, which I said you mightn't even notice. And then on the out breath, everything comes back again. You don't have to hold for 4, in for 4, out for 4, just nice and easy in your own time, okay? So the only thing, as I say, it's worth sometimes a mirror if you need it, that you're not coming up into the shoulders. So then what we want to do is we want to make sure we're getting this contraction correct. So I'm going to put the breathing to a side for a second. So you have loads of muscles in that pelvis, okay, in that pelvic floor. So these are all the muscles. That's one of the hip muscles. And then all the rest of the pelvic floor. So you can understand how it can kind of get quite complex, but incredible how it all works. So what we want to do is get these muscles working really well. So predominantly, if men have any urinary issues, they should be pulling up from the testicles up to the tummy. So nuts to guts, which is what I find most of the men seem to like. So you're pulling up at the testicles and it's nuts to guts, okay? And so that's really, really important. But to add in just a little bit more of a difficult dimension, we want to do this with your breathing. So back to our nice breathing. So you're taking that nice breath in, okay? On the out breath, you're doing nuts to guts. So you're lifting up from testicles up to tummy. So as if you were in front of a mirror, you should be able to see that penis lift up, okay? And that's the action you're getting. I don't want to, I'm pulling in everything like this and the necks and everything getting tight, because in the end of the day, you're going to chase after your dog or play your tennis or your golf. You need that pelvic floor kicking in. So that's the end game we're looking for. So we just need to make sure you get it right to start with. So nice and easy again. So you're breathing in to prepare. On the out breath, you're pulling in that pelvic floor, so nuts to guts. And then we're going to see how long you can hold. So I want you to hold while you continue just breathing away normally. Okay, so let's let everything go again. When I'm going to ask you to hold, I'm going to get you to count out loud. So let's breathe in to prepare. Okay, on the out breath, you're pulling in nuts to guts, continue breathing, and I'm still holding, I can't do two hands, so I'm still holding my pelvic floor and I'm breathing away. Oh, I can do two things at once. So what, 2, 3, 4, 5, and let go. And so you should feel everything leaving go. But what's really important is if you were doing that and you were doing 1, 2, 3, 4, 5, that means I'm beginning to hold my breath because I'm beginning to tighten up. So that's why speaking out loud is quite a good one, because you can hear whether you're beginning to hold your breath or not. And that's really important, because if whatever you want to do, you need to be able to use that pelvic floor without holding your breath. So with all of my patients, that's what I start off with, just the basics to make sure it's correct. And so you're not going to do much strengthening with just doing that at the moment. But if you can't do a pelvic floor, you have to start somewhere.
Yeah. So
as you get better, what we want you to be doing this in standing, because it has shown in men with Joe Milios's research, they do much better in a standing position. So as quick as I can get a patient into doing it in standing, I'll try them maybe in lying or sitting. And as soon as I can get them into standing, they're standing doing their exercises. Okay. And so what you want to do is you're doing the same thing in standing. So you're breathing in to prepare. On the out breath, you're pulling in that pelvic floor and you're continuing to breathe away. You're counting to 10 out loud initially to make sure you're not holding your breath. Then let go, relax. So 2 things with any working your pelvic floor is make sure you breathe and make sure you let go. We don't want you walking around like that. That's so important to let it go. Physios, we want full range of movement. Okay. So you've had a few seconds rest, repeat it again. And so in the end, you're going to repeat that up to 10 times. So you'd be holding for 10 seconds, resting for 10 and repeating 10 times. And as you get to be able to do this, we want you doing that 6 times a day. You equally have to be able to hold that pelvic floor quite quickly. And this is where, if you were going breathe in, breathe out, you get all a bit dizzy and confused. So to do the quick ones, you literally are doing nuts to guts, let go. Nuts to guts, let go. Nuts to guts, let go. But with those, some patients, they want to do this. So really make sure you squeeze that pelvic floor. It doesn't matter how long it takes to open it. Then once it's opened, make sure and squeeze again. And it doesn't matter how long it takes to squeeze it. And that's what you're waiting for. And so as you get better, that's where the speed will get better. We might call them the quick, the speed, the fast, the whatever. But the most important thing is to make sure that you're letting it open up first before you contract it again. And that's really important. Otherwise, we won't get the feedback and we won't get, what we want these muscles to do. With my patients, I tend to call the endurance the Mo Farahs. And I call the squeeze ones, the fast ones, the bolts. I need 2 new runners. So that's what I tend to describe them as. But as I explain to all my patients, with pelvic floor, you need to increase the strength of the muscle and get the muscles working. But equally, we also need to learn how to use these muscles, and especially with the men. So, for example, you're going to stand up. So you're breathing in to prepare. You're on the out breath, you're squeezing that pelvic floor and you're standing up. Okay, then you stand up, let everything go. Okay, I'm going to sit down now, breathing in to prepare, breathing out, squeezing that pelvic floor and sit down, and then let go, because it's teaching you how to use it functionally. And that's even more important with the men, it's extremely important. So you can start bringing that into, if you're putting something in the boot of the car, you're putting something up on a top shelf, whatever it is you need to do. And that's extremely important. I know I haven't mentioned the back passage too much, and especially for gentlemen who are going for radiotherapy or anything, they're going to need to make sure those muscles are working. But we just have to be careful they don't overtake all the rest of the pelvic floor. So do get used to the front bit first. And then I tend to add in, back passage and lifting and zipping it right up, but just don't let all those muscles take over. That's the kind of me, without assessing, making sure, to give you some advice. But if you have any queries, look for a pelvic health specialist who treats men near you. And if you're struggling, the Squeezy app is very good to give you who you can go to.
Yes, because we've got the Squeezy app for men now, haven't we?
Yeah.
Available. The other resource I would say is really good is Pelvic Raw. They have got a website and they've got a men's health section there. On the Squeezy directory, you can put in your postcode and find the nearest men's pelvic health physio to you. And that will list people that are private practicing and also on the NHS. Not all of the physios are on there because they've needed to get themselves registered on there. But that's a really good place to better find a women's and men's pelvic health physio. So they are definitely our go-tos. And like you said there, Debbie, having an assessment done by a physio is really useful, isn't it? And again, the men's health physios, not your MSK physio.
No.
Be sure that you look for a men's health
pelvic
physio.
health, the pelvic health men's health physio.
Yeah, and they will be registered, and they're used to doing this every day of the week. That's their job, and they will be able to also offer you other resources that are available. So, Debbie, thank you. Thank you.
No problem at all.
I think we've covered it, haven't we? Kind of. We've given the basics of pelvic floor exercises. Yeah, that's wonderful.
Yeah.
You're a star. Thank you so much for everything that you've done for us. And she's disappeared on her camera.
Let's come back again.
Darling, lots of
Thank
love.
you, Louise.
We really appreciate your help. Thank you.
No problem. Thank you.
Bye-bye.